good afternoon, and I want to thank you for joining us. I think mostly everyone on this call knows who I am, but if not, I am the Vice President of Operations for YMCA Buffalo Niagara. We're halfway through our 14-day equity challenge, and I hope the materials that we have provided to you thus far have helped you develop a deeper understanding of how inequity impacts our community. Today, we're going to host an open discussion about these important topics. And to help us get started, I'm going to introduce Danielle Roberts, Executive Director of the Delaware and William Emsley YMCA, talk a little bit more about today's topics, and welcome our panelists. Danielle.
Good afternoon. Thank you, Anne, and thank you everyone for making time today to dig a little deeper into our equity challenge. Together, we will continue to learn and focus on our values, our shared mission of creating and leveraging the knowledge for a greater good. As you know, health equity is defined as the condition in which everyone has the opportunity to attain their full health potential, and no one is disadvantaged from achieving this potential because of their social position or other socially determined circumstances. The need for equity is very real, as inequities affect the health and the wellness of millions of people, including people in our community right here in Buffalo. So your work, no matter what community you're in, can make a difference in someone's life and in the community's overall health. So we're going to go ahead and get started. We have some special guest panelists with us today. I'm very happy to introduce three community leaders in this work. And the first person I'm going to introduce is Ms. Rene Petties-Jones. She is the president of the National Federation for Just Communities of Western New York. And we also have Ms. Kendra Brim, who is the director of diversity, inclusion, and opportunity at Nardin Academy. She's also on the YMCA advisory board. She's a community builder and an advocate. And last but certainly not least, we have Zenata Everhart, who is the Director of Diversity and Inclusion for New York State Senator Tim Kennedy's 63rd District. So I just thank you ladies so much for taking the time and joining us today. We appreciate you sharing your knowledge and your expertise with us and the participants in this challenge. We don't want to take up too much time this afternoon, but we do have some reflection questions that are already prepared. But we also invite everyone who is on this call, all participants, if you have any questions or any comments, feel free to please leave those in the chat, and we will have our participants respond to your questions or comments as you add them. We'll go ahead and get started with our first question. Our challenge yesterday, you've been learning about health disparities, and I hope you are enjoying the information and the materials that we've been sharing thus far. So the first question that I want to put out to the panelists is, what is one thing that we can do to positively impact health disparities, especially during a pandemic?
I'll start with that question. Thank you, Danielle, and hello, everyone. And so in my work, I do a lot of work with health disparities. And the number one thing about health disparities is that we have to understand that health disparities is not just about getting the right level of care at your doctor's office, right? I mean, while that is very important, and that is, that's at the top, right? We want to make sure that people are getting the types of services that they need. We want to make sure that they're getting the medications they need, and that their doctors are actually listening to them, right? But a part of health disparities is also the neighborhood you live in, right? It's about the type of housing that you live in, your zip code, right? Do you have access to healthy foods? Your education level is a part of health disparities. Those are all things those are root causes, right? So we can take, for example, we have a certain group of people who are suffering at high rates from heart disease, right? But when you break that data down and you look deeper into that data, you find out that they live in zip codes where the air quality is bad, where there's no access to grocery stores, where, the schools are bad schools, right? And so we have to make sure that when we're talking about health disparities, that we're talking about a holistic approach to fixing issues with health disparities. It's not just making sure they get to the doctor, but it's also making sure that they get fresh fruits and vegetables, and that the air quality in their neighborhoods is good, and that the sidewalks are good, right? So they can ride their bikes and they can get out there and walk. And things like that. And there's not large levels of trash laying around on the ground and things like that. So when we're talking about health disparities, we definitely have to take a deeper look into the actual individual person and see where they're coming from, what their background is, things like that.
For sure. Thank you so much for your input. Zenata, does anyone else have anything to add to that?
I might add in also about taking care of our mental health as well. As we look at Mental Health Awareness Month, the trauma that comes with systemic racism is real. And understanding that can and does impact our health. So just examining some of the issues that we are talking about when you're looking at this 14-day challenge, knowing that can impact moving forward how someone is healthy or not healthy, and that can be passed down from generation to generation to generation. So I think that taking into account that mental health piece is very important as we look at that holistic approach to healthy living and equal access.
One of the things our participants can take a resource that has been put into the chat. If you haven't seen it, it is a health equity resource guide. And so there are some definitions and things that will help us to continue to learn about health equity and things that we can do to help health disparities. And we're going to go into our next question, and Rene kind of talked about systemic racism. And so what is the biggest piece of advice for continuing to heal the racial divide and address systemic racism? And I know that's a loaded question and there's not just one answer, but if you could just give us a little bit of insight on what you think on that.
I guess I'll start with that. So like Danielle said, it is a very loaded question. It is something that has been around for a very long time, but it kind of has been under the radar for a few years up until about last year. And in order to address it, for me personally, I always lead with compassion and I lead with understanding. And I think that is the first step. A lot of times, we want to react because we're humans, and anger and frustration. But I also, for me, like I said, I lead with love, compassion, kindness, understanding. And that's the way that we can start to divide the racial divide that currently exists, especially within Western New York. Also, in terms of that, we've been having a lot of discussions such as these, a lot of panel discussions, roundtables, things of that nature. And for me, I'm ready to move past that and go towards action, right? And so what does that action look like? And in order to have the action, we have to have that understanding. Also, too, we need to make sure that we're putting measurable outcomes in place. A lot of times we are just doing programming and things like that, but how are we measuring attitudes? How are we measuring, different things that we want to measure within our organizations, whether that's retention, whether that is hiring practices, whether that is engagement within our organizations. But before we get there, we have to make sure that we are communicating with each other, trusting each other. And that is the foundation of making sure that we're moving past this racial divide that we see today.
Mm-hmm. And I'll just add to that. For me, it's, a lot of what Kendra said. Absolutely. It's all of that. And it's actually just being honest about it, right? A lot of people don't like to just say that systemic racism is a thing. They like to gloss over it. They don't think that it's a real barrier to certain groups of people and things like that. And for me, just like Kendra said, it's about using my voice, right? And using my platform to let people know that, not only, yes, I work for a New York State Senator and things like that, but I'm also a Black woman. And so I know the effects of systemic racism. It has hit home for me. It has hit home for my family members. And so when we're not willing to talk about it and just actually, say that it exists, that creates a problem in itself.
And just to add in, I kind of say that same thing that, the esteemed panelists are mentioning, just seeing me for who I am and not looking at my color first, but realizing that that bias, and I know that that's some things that we are going to talk about, precedes me. I want people to know and learn me. What do I bring them? What is my value and what is my expertise? Not what color am I? Do I fit that demographic? Do I fit that stereotype of who you might perceive? Or making sure that you are just listening to your neighbors to learn more about what they are all about, what's on their mind, what makes them think and tick the way that they do, and understanding that not everyone is in the same space. So part of healing that divide is understanding that people are coming from this at different angles and recognizing and appreciating whatever angle they may be looking at and not becoming defensive. And I know so many people do react in that defensive mode, but I really hope that people will start to become more welcoming, more open, more able to have these discussions like this so that they are moving past, as Kendra has said, moving past this discussion into the action.
Thank you very much. Those points are well taken, and really kind of the purpose of our challenge to get individuals to take action on a daily basis, right? So we're having this conversation, but individually, we're learning and we're growing and we're taking actions. And so to add to that, in terms of actions, the next question leads into, and it's, what are some easy to replicate programs or some programs that you've put into place to make a difference in the areas of diversity, equity, inclusion? What ideas do you have on that?
I guess I'll start again. Well, one program that I absolutely love, and this is Rene from NFJC, was the Healing Circles. And I participated in that last year, and it was really cathartic for me, especially during that period of time. And so I appreciate that. So thank you to you and your organization. And I actually replicated that here at Nardin with our students. So that is something that I was able to replicate as well. Obviously, the 14-day challenge with the YMCA has been great. I know the United Way of Buffalo has a 21-day equity challenge coming up. And so those are just programs within our local area. But also, too, I think it's really important to make sure that we're creating safe spaces within the groups and organizations that we occupy. And so for me, it's really important to create those spaces and have those affinity groups as well. And so I've been really intentional with that. And I think it's been helping here, specifically at Nardin, with our students. And it's for all students, and it's not to say that anyone is not welcome, but it also creates that safe space for everyone to have those conversations. And so for me, it's really been a great time of forming those different groups.
And I'll just add to that, some of the things that the Senator's office that we do is we do a lot of large scale events in the community, and we do a lot of small scale events, right? But one of the things we do is we make sure that whenever we're hiring people for different services for these events, we make sure that they are MWBEs, right? We make sure that minority and women-owned businesses are at the forefront of providing those services, whether it's, hiring out for catering or just like, gift bags and things like that. We always include MWBEs in any of our events. And another thing that we do is making sure, because a lot of people reach out to us looking for recommendations for different boards and, advisory committees and things like that. We always recommend minorities and women for those boards, because that is the key, one of the keys to breaking down systemic racism, right? You need different types of people at the table. If they don't have a seat at the table, their neighborhoods will never change. And I'm not talking about executives from, big organizations or anything like that. I'm talking about, we nominate people from block clubs, right? Because those are the most important people, because they see first the issues in their community. And so I think that that's something that's really important. And like Kendra said, the racial healing circles are absolutely amazing. I've been a part of them since the beginning. I'm one of the trained facilitators. Thank you, Rene. And those have been amazing. And I think that all organizations should be participating in them. They're awesome.
I thank you so much for those that plug for those circles, because I agree. I think that's a great way to kind of have a normalized conversation with people that are different, and bringing them in together. And I think Zenata hit something that's really important, even though we've been struggling throughout the pandemic of trying to bring people together, having those opportunities to see people that you might not interact with on a normal basis, and just being able to have that shared commonality experience. And I think as we start to see things open up and ease up a little, that connectivity between all of us in our communities will start to help bridge some of those divides. Because of course we live in our silos, and this pandemic did nothing more than can increase that. So having this opportunity to get into neighborhoods, into events, into community opportunities, and going back into seeing one another face to face, we'll start to be able to bridge those divides and bring us better together. Even though our racial healing circles are still out there, we are still hoping at some point that we can do them in person. When it's safe to do that, we definitely want to be able to see that face-to-face interaction with each other.
Thank you again for your input on that. I cannot help but, stick in there that the Y has initiated the Y on the Fly program, because it is something that we will be able to get out into the communities and be able to serve kids who cannot come to the Y. And so it's an action program, and I'm proud that we're going to be launching that. So if there's anyone who's interested in volunteering on that or wants more information, we'd certainly be happy to share that. Because as you all have pointed out, it's really going to be about, getting out and doing the work, not just talking about it. So thank you for that. And we only have a couple more questions, and I don't see any comments in the chat. So anyone on here, please, if you have comments or if you have questions or anything, please feel free to add them. One of our next questions that we have is kind of tied into what we've already been talking about, but where can we find resources to learn more about racial issues or diversity, equity, and inclusion, locally or nationally, if you have that? We already put one reference, and we'll also be adding more references as we go through the challenge. But do you guys have any resources that you can point us in that direction?
I don't mind starting on this one. Our website has a host of resources that we're constantly building on. And I see our consultant that is on the call here, which she constantly gives us content. So visit our website, www.nfjcwny.org, and there is a resource section that is constantly adapting and changing, because again, when you're talking about all of these issues, it needs to be age and group appropriate. So we've got some resources that are good for kids, because the way you would talk to kids about these issues are going to be different than the way we might talk with one another here. So check out those resources, constantly changing. We're always looking for input on that page and that site, but it does have reading materials. I think the biggest thing that we can emphasize enough here is education. The more you know, the better you'll be able to understand these issues and be able to help work to dismantle the systems that have been in place for so long. But if you don't understand the history of the systems, where they began and where they may be headed towards, how can you work towards changing them? So the more education that we can all get, the better we will all be as a community.
I have the second. I send people to NFJC's website all the time, because the resources on there are amazing and they're really helpful. Like she said, whether we're talking about school-age kids or we're talking about businesses. Another resource is the Racial Equity Roundtable itself, right? Organizations and businesses in the community can join that roundtable, and they do the racial impact analysis training, right, for businesses and organizations. And that's very important. And, when we're talking about top-down organizations and changing the racial lens and how we're looking at racial things, I would recommend that all organizations and businesses join the Racial Equity Roundtable. And then to go back just a little bit to talk about some of the things that we're doing, one thing I forgot about is legislation, right? I work for New York State Senator Tim Kennedy. And so my job, a lot of times when people think of diversity and inclusion, they think of HR, right? And so I tell people all the time, like, I don't do any HR work. My work is actually about on the ground in the community, making sure that we're doing, diversity and inclusion work, but it's also in legislation and making sure that all pieces of legislation that the senator is supporting is looked at through a racial equity lens, right? We want to make sure that the bills and laws that we pass in this state has a reflection of the actual people in this state, right? So right now we're working on several bills, including kind of like what I just said with the racial impact analysis training. We're working on something with that to make that a requirement for state and public and private employees throughout New York State. That's very important that organizations and businesses get a better understanding of biases and things like that. So those are just some of the things that we're working on. But yeah, that's it.
I'm so glad. Oh, I was gonna say, I'm so glad, Zenata, that you said that. Like, I'm so glad you talked about legislation, because that's definitely a way that you can get behind so many different policies, not only locally, but nationwide. And I'm very much involved in so many different things locally. And I would say, like, get involved with other non-for-profits as well that's backing something that you're passionate about. For me, I'm very much involved with the Urban League. And so we're really working on the Policing Act and getting that passed through legislation, really working at the grassroots level and educating people on that. And so just, get involved in your organizations, your block clubs, all of those different things. And one thing that I'm starting to explore personally outside of the racial diversity is also looking at ability versus disability, especially as we're looking at education within schools. And that's something that not a lot of people really discuss. And so I'm doing more education on that as well. So definitely, like you said, Rene, education is power, is knowledge, and definitely get behind a cause and follow that.
Thank you very much. We have a question in our chat, and it actually leads to what we were going to talk about next. And it is, what is the design of the healing circles? So Rene, if you would like to go ahead and take some time to talk about the racial healing circles, the design, and some exciting upcoming news.
Absolutely. And I know Zenata can jump in at any time, and so can Kendra to speak directly to it. The circles are designed to bring people together to have safe conversations in a safe space. We bring in guided facilitators, Zenata being one of them, of many facilitators that come into the space, where we'll just spend a moment to just digest and talk about an issue. We usually look to making sure that we are keeping our ears to what's happening out in the news and in our communities to make sure that we tailor the circles surrounding something that's pressing at the moment. But then we give all participants, an opportunity to share as much or as little as they are comfortable. Guided questions go into smaller breakout rooms where, again, you have that intimate conversation with one another. Again, with that understanding and that knowledge of it being a safe space, they're open to community members. We are very, very excited to be able to partner with the Y to bring in a Y-centered racial healing circle. So we are really hoping that we can get as many participants to sign up for that and join us in this conversation. It seems, a lot of people look at it and say, oh, gee, I have to sit for an hour and a half, 2 hours. It will go by so quickly, because once you get into these conversations and you start feeling comfortable opening up and learning more about one another, you want it to keep going. So again, I really do encourage people to have these very honest and real and sometimes raw conversations. And one thing about racial healing and racial equity work, you have to sometimes sit in some uncomfortable positions. So when you're sitting in that, it just feels better when you're with someone else that also understands and can empathize with what you're speaking to. So definitely join in for that. The other opportunity that for those that are interested, we have an Upstander project that we're doing starting tomorrow evening, and you can join us. It's going to talk about what can we do as a community to be an Upstander? How can we support one another? One of the examples that Kendra just brought to mind, one of the angles that we're going to talk about is when you see something in the community that may be uncomfortable, say someone that can't reach something on the shelf, do you step right in and help them? Or do you sit back and allow them to be able to do what they're comfortable with doing? And where do you know and understand that line? So this Upstander project will help to break down some of those misunderstandings, those conversations that people feel very awkward about. Do I step in when I see two people arguing or saying something that may be uncomfortable? Just join us in these educational opportunities, and I think that will help to always broaden our knowledge base. So feel free to join in for that. It's a very simple registration form that you can find at bit.ly/upstander, with a capital U, Upstander 21. So please feel free to join in on that anytime. And of course, please join us for that circle. I think you will really find it to be very, very transformational.
Thank you. So in reflecting on, everything that we've talked about today, if there's anything that anyone wants to add in closing in terms of what we've talked about, if there's anyone who would like to add something to the chat, we'll certainly reflect there. Otherwise, I'll turn it over to Ann for our closing remarks.
Thank you, Danielle. Oh, I'm sorry.
I appreciate all of you, I was going to say, for your feedback and everything that you added to the conversation. I think this was a positive conversation today. I think that we have so much to take from it and do some personal work on our own. And I just wanted to add that, as we move forward, we will add different topics, and we look to do different challenges as we go along. And we hope that, everyone who's participating will find their way in their voice and their way to take action. So thank you, ladies, so much for your input. Sorry, Ann.
No, Danielle, I echo your thoughts. I want to thank Kendra, Zenata, and Rene for your time today. And I want to thank all of you for participating. And again, just echo what Danielle said, that hopefully these conversations help you better understand how inequity and racism impacts our lives and our communities. And just a reminder, if you haven't done so, please join the Better Us community group on Facebook. It's really a great way to connect with others who are participating in this challenge, and an opportunity to share your thoughts, reflections about the materials, questions, and just some dialogue. And again, if you have any questions, please feel free to reach out to us. I want to thank all of you again for your time today. Have a great day. Enjoy the sun. Thank you all. Thank you.